So we're talking about blood circulation disorder. Last week we finished edema and hyperemia and congestions and bleeding problems. So that's the last week we discussed. Today we're talking about homostasis and how blood they can stop bleeding. So that's blood coagulation. So that's we start from here. So what means homostasis? So homostasis is basically talking about blood flowing inside of blood vessels. And if something happens, like a bleeding situation happens, then they can stop bleeding. So they can form a plaque and then stop bleeding. So that's the normal process of our body's normal functions, preventing big bleeding. Like sometimes by accident, we cut off our fingers and some blood coming out. But after a couple minutes, the blood automatically stops bleeding. So that's our body's normal functions. So basically, what's the effect of the homostasis? So basically, we have three aspects affected or depending these three special aspects decided homostasis happens. The first is the blood vessels wall. Blood vessels wall basically is connected, not damaged. But if damage happens in there, immediately your body knows it's bleeding happens in there. Then platelets will go to locally, form some platelet plaque in there. And then other protein will be coming to local area. And finally stop bleeding. So that's generally speaking. So that's the process. It's a little bit more than we're thinking about. So basically we're talking about right after when blood vessels is damaged or cut off there. Then firstly, still blood vessel, smooth muscle there, spasm. So like we say, normally that's like the dialect of the blood vessels. And after vessel spasm, the dialect will be changing to smaller. Certainly smaller kind of blood coming from smaller dialect blood vessels. So that's easily we stop bleeding. And then we talking about platelets will be coming. Form a platelets plaque. Some platelets go to local blood vessel there, try to stop bleeding there. and then blood clots forming is stop bleeding. And finally, some fabric tissue will be go to like blood clots there and stop the hole, close the hole, and stop bleeding, and for long term. So that's the process of homostasis. So hemostasis is the body normal functions stop bleeding, the process, and they form the like a cross to stop bleeding, and the blood will be coagulation. So that's the normal function of the body. Then we're talking about some other situations. What means other situations? So other situations, it happens in the blood vessels. We say normally when blood vessels is cut off or damaged or injured, then form the kind of clots to stop bleeding in that way. But in some situations, in some special situations, we're talking about nothing truly happens there, but some blood clots is forming inside the blood vessel. That kind of situation we call Embolism. So that's we say the formation of a solid or maybe semi-solid kind of mass from the blood circulation, and when in blood truly circulation in the bodies during the life. So that belong to abnormal kind of condition or harmful kind of condition. So what's affected? What's affected for these kind of condition? So basically we have three reasons that may be easily cause this kind of thrombosis formation. So thrombosis formation is abnormal condition or pathology kind of condition. It's not a normal condition. It's form of solid or semi-solid kind of masses inside the blood vessels. So we say we have three reasons maybe cause these problems. The first reason is internal blood vessels, some cells may be damaged. Blood vessels is composed by many cells connected to each other. Some cells form a cover of the blood vessels. So some cells or the cover damaged there. So our body may be thinking about that blood vessel damage. And then what will be happens? So then they will be happens bloodless becoming and some protein, fabric and protein coming, and then stop some, we say it's not bleeding here, but truly it's affected of a normal blood flowing way. some severe case, they may be totally blocking the blood flowing way. So that's caused severe kind of problems or disorder. So that's basically happens. So we see some detail here. The first aspect is internal blood vessels cells damaged or injured. So that's the first reason to trigger some blood stasis happens in the blood circulation. So this kind of trigger, sometimes it happens, it's not the blood vessels itself. Like we're always talking about something in blood circulations, sometimes they may damage blood vessels. For example, we're talking about the fat. Too much fatty material in the blood circulation, they are pretty easily attaching inside the blood vessels, cells there. Normally, blood vessel inside cells there is pretty smoothly, and the blood passing through pretty easily. Now something touching there, it can make it rough there. It's not smoothly anymore. So that's still kind of inside blood vessels kind of injured in there. So that's the first aspect. If that things happens, certainly our body will thinking about that some damaged blood vessel there. Then they try to bring the bloodlines coming and try to stop something damaged there, but not truly happens. So that's the first aspect. Then we're talking about the second aspect. We say normally, physically, normally condition, blood flowing is pretty smoothly, and like a center part moving a little bit faster, side part a little bit slow, but still smoothly there. So that's the normal condition. Normal condition. So when we talking about something happens, when we talking about something happens, so that kind of flowing will be like affected. Like we talking about something here blocking the blood flowing. Certainly, blood flowing will not that smoothly anymore. And then that will be caused platelets attaching to the local inside blood vessel there. And then they blocking the blood flowing. So that's finally will be caused clogged. And if it happens, like gradually happens for a long term, they will be totally blocking the blood flowing in that blood vessel. So that's basically happens inside the blood vessels when they stop bleeding there. Some blood stasis when people is living there, but they still blood stasis happens. And another aspect is effect of the blood easily forming blood stasis is the blood itself has some disorder. Hyper, we always talking about hair. Hyper always means hair. coagulability means their blood easily causes blood stasis. So the reason cause it may be some genetic reason. People have genetic disorder. Their blood pretty easily causes blood stasis. And maybe by some other illness. But whatever is genetic reason or caused by other illness, their blood pretty easily to cause blood stasis in the blood vessels and then cause the other issue or problems. So the picture here just show us how it happens. So basically, it's something happens in here first, in this area first. You can see the blood like the cells is coming this way, and then they broken this way in here, and then like something go to this area. So we're talking about platelets coming first, and some fibrils coming. That belong to plasma protein. So basically, we have more than 10 different kind of plasma protein will go to this process if they try to stop bleeding. So you can see the blood flowing in this part is pretty smoothly, like this way. This, we have something blocking here. The blood flowing will be changing. They passing this small area, and then they are changing, form some circles like this way. Truly, it's not that smoothly blood flowing way. That truly happens inside the blood vessels. Yeah. So that's blood vessels here. That's some smooth muscles covered blood vessels. But pretty inside part, we have kind of lean, kind of cells in there. If it damage, it truly trigger like blood stasis happens in the blood vessels. Then we talk about situations, embolism. What means embolism? Yeah. It's kind of embolus. Like we're talking about, it is, for example, they can falling down from the blood clots here, and then they falling down to the blood circulation, then they travel to other part of the blood circulation. It also possible some gas kind of masses. Gas kind of masses is not that easily happens. So one special kind of situation, like some people go to pretty deep of the oceans and thus absorbed more gas in the blood. And if they suddenly coming out, they may form some gases in the blood circulation. And also maybe by some accidents, like when people go to injections, and then by accident some gas possible go to blood circulation. And that sometimes happens, and also possible happens during baby delivery. during baby delivery truly have some possible accidents possible happen. So whatever is kind of solid liquid in there, or maybe gas in there, whatever, they may blocking blood flowing way. Yeah, they travel by the blood systems. They follow the blood flowing, and finally they blocking the blood flowing. That kind of situation we call it embolism. So anything blocking blood flowing totally. So that's some example here. So that's the vein. Yeah, that's the vein in the leg. It's a deep vein in the leg. And for some reasons, we can see some blood clots in here formed already. Make it pretty narrow, blood flowing go to this way. And then part of them falling down, like in here. It's falling down. Then they go to blood circulation. So this part, we call it embolism. So this part, they go to blood circulations. They will go to other part of the bodies. They finally will be stopping somewhere. Like blood vessels, we're talking about blood circulations. We have pulmonary circulation. I separate the heart and the lung here, but truly they will be pretty close to each other. That's the easy way we can see it. So blood circulation, we say, from the right side of the heart, blood circulation go to the lung. That's the low oxygen kind of blood. And after to the lung capillaries, and the blood return back to left side of the heart. That's the rich kind of oxygen kind of blood. And this oxygen kind of blood will follow big blood vessels, go to the tissues capillaries. And after tissues capillaries, gas changing. Oxygen go to the tissue. Carbon dioxide come back. And then low oxygen kind of blood return back to right side of the heart. So that's the circulation like this. So the case like this patient, they have embolism falling down from the leg. The blood circulation will be go to the right side of the heart first. But the blood vessel in here and the heart, like a chamber in here, pretty bigger. They will not stop there. They still follow the blood circulation go to the lung. In lung area, they will blood vessel changing pretty smaller. We call capillary, capillary in lung area. In that area, this ambulance will be stopped there because that area is pretty narrow. They couldn't pass in through again. So they will blocking in there. So that's we talking about coming from the vein side. So it will be blocking or stop in the lung area. Then we're talking about after blocking, what will be happen. Then let's talking about what caused embolism. Yeah, what caused embolism? So most of them, we're talking about 99% coming from, we're just talking about a big blood clots inside blood vessels, and then falling down. So that's 99% is big case. Other reasons, some platelet disorder, they are grouped together. And also we're talking about small pieces, like some ulcers inside blood vessels, and then falling down. And occasionally some pieces of the tumors still in the blood circulation, they falling down. And some small pieces of fatty tissue, and some gas by accident, and during the baby delivery, some fluid coming from the uterus, and also some infection kind of material in the blood circulation, and maybe some bone marrow. So that's we have a lot of reasons possible cause this problem, but we say mostly is coming from the soluble, like a blood clot inside the blood circulation. So we say this kind of clots is falling down and then blocking the blood circulations. Mainly it happens in two parts of the body. One part, it happens in the lung, just like I drew the picture before. So that kind of clots, it falling down and follow the blood circulations. They go to right side of the heart first, then they go to the lung. In lung area, the blood vessels is pretty smaller. Yeah, they bunch it. Then they blocking there. That's coming from the, generally we say, coming from the vein side, or coming from right side of the heart. If this one, that kind of clots coming from left side of the heart, means something happens after the lung, including left side of heart. For example, something formed inside of the left side of heart, then they falling down. They will follow the blood circulations. They passing big artery first, then go to tissue, all over body, small artery, then they will be blocking it. So that's depending where they blocking. The problems may be very severe, maybe not that severe. And if they blocking, if we're talking about something embolism, blocking the tissues, blood supply, and that kind of tissue will be death. So death caused by blocking blood supply to the tissues. We give it a special name, Infarction. So that's basically we're talking about blocking blood supply to the tissue and then cause the tissue die. So that's basically we finish 4 conditions about blood circulation disorder. So then we're talking about another disorder. Still happens in the blood. So this disorder, generally speaking, blood stasis all over the body, blood vessels. That's pretty severe kind of disorder. That's usually we call it DIC. Blood clots inside blood vessels all over the body. So that means DIC. It could be acute one, could be chronic one, but truly blood stasis happens in the blood circulation. They cause 2 different kinds of disorders. One kind of disorder, when blood stasis happens in the blood vessels, they will blocking blood flowing way. So that's we're talking about hemostasis. And another aspected disorder, because they form so many homostasis inside the blood vessels, they consuming most part like plasma protein and platelets. So they couldn't stop bleeding anyway. So that's basically 2 aspects happens during this disorder. So that's just the picture show us. You can see lot of blood cells and including some platelets, they together in the blood circulation. And another situation is you can see bleeding everywhere, all over the body. Bleeding under the skin from the like a red color in there, blister in there. And this one also. So bleeding under the skin is not truly bleeding out, but truly the blood bleeding under the skin, and we can see all over the body. So that kind of condition. DIC can happen like many illness, like ending stage, like a patient have cancer, and the ending stage, they will happen for DIC. So DIC is a very severe kind of disorder. We say blood clots inside blood circulation. It will not sending blood or sending oxygen to the tissue. Tissue will losing oxygen. And also they cause the bleeding. So that's a very severe kind of disorder. So this kind of complicated disorder usually we will not see in our acupuncture clinic. Usually they will go to hospitalized. Need understanding what truly happens in DIC and what causes DIC. So DIC is not like an illness name. It's a pathology stage for a lot of severe kind of illness at the later stage. So that's pathology changing. So that's we're talking about DIC. Then we go to the shock. Then we go to the shock. So what means shock? What means shock? So shock is the condition like a circulation systems disorder, like a circulation systems failure. They couldn't keeping the blood circulation properly. They couldn't deliver oxygen and nutrition to the tissues. So that's the shock. That's the shock. So in the shock, most case blood pressure will be low. So we say blood pressure, we separate like two parts. One is the high part, one is the low part. So generally speaking, the blood pressure is less than 90 milligrams. So that's basically we're talking about the shock. Certainly, when people during the shock condition, they are not only blood pressure decrease, and also we're talking about some people, if they long-term chronic low blood pressure, it not belong to shock. So normally we're talking about the shock here, especially we're talking about blood pressure here. We're talking about blood pressure from normal, suddenly dropping down to pretty low. That means shock and shock condition. Shock, still not kind of illness name, still a pathology kind of process or changing. So shock can happen by different reasons. One reason is blood values decreased. Poor is the medical word, low. Hyper is low. Hyper is high, hyper is lower. So don't confuse these two words. So like people suddenly losing blood, big bleeding. Or maybe by accident, by the trauma, and cause the bleeding. Thus blood values decrease. Thus can cause the people shock. Not enough blood. And heart disorder can cause the people shock. For example, we just talking about heart attacking. Heart blood vessels, coronary artery is be blocked. So certainly sending to the heart muscles is the blood is stop going there. And the heart muscles losing nutrition, losing oxygen, the cells will be dead or maybe cause the heart failure. So that's a severe kind of condition. Certainly they couldn't bump the blood coming out. So if it totally stopped, people will be immediately dead. But if small area, losing function, other part, the heart still can working, but they pushing blood to the circulation values decrease. So that's heart issue can cause. And also, people didn't losing blood. And the heart working well. But they sending the blood not even to all over the bodies. Like some part of the blood vessels, they dilate. They holding no more blood in the locally for some pathology reasons. The other part of the body still don't have enough blood. Similar like blood values decrease. So that kind of condition we say distributive kind of condition. So just some detail here. We say blood value decreased. And that's lending, like oxygen sending to the tissue decreased. So generally speaking, not enough blood go back to heart. So per lending decreased, means not enough blood. And the output decreased because like originally per beat usually we talk about 50 to 60 millimeters per beat. Now the blood only return back about 30 or 40 in there. So that's truly per beat is decreased. Per beat decreased, output is decreased. So tissue don't have oxygen, don't have nutrition. And for heart issue, heart is the pump. Heart is the pump. Pushing blood go to the circulation system, go to blood vessels. When the pump dysfunctions, heart failure like. So truly not enough blood circulation to the tissues and cause shock. And another reason we're talking about distributions kind of shock. So that's basically we're talking about locally peripheral blood vessel dilate and lending most blood go to like dilate blood vessels. In the circulations, they will be decreased. So that's the reasons cause shock. We have another special kind of shock we call by the reasons septic shock. So this kind of shock basically caused by the microorganism, passenger infection. We say mainly is bacteria. Bacteria we separate different category. We have gram-negative, we have gram-positive. So it's mainly caused by gram-negative kind of bacterial infection. So that's a big category. So they will have some toxins released to the circulation systems and then cause the people shock. And occasionally, still possible by gram-positive kind of bacteria, or maybe some fungi infection. So when we learn microorganisms, we will learn detail about gram-negative and gram-positive. But we just try to remember, we have one kind of shock especially can caused by microorganism infections. Mainly part is gram-negative. When we talk about shock, what's the symptoms clinically will be show up? Then we know people shock. So basically, when people getting shock, when we feel the pulse, usually is weaker and rapid pulse. And the patient like terminal air is cold and maybe have some cold sweating there. And the skin color kind of, it's not truly pink, but between pink and purple. Yeah, so that's the low oxygen kind of blood inside of the body. And if in the, we just talking about special kind of shock, sympathetic shock. So from the beginning, the skin may be warm. So that's because the blood vessels dilate. And severe case, patient will have mental confusion and maybe restless and maybe decreased urine. And severe case, people losing consciousness, that's what we call coma, and even death. So shock still a severe kind of disorder in the blood circulation systems because they couldn't sending blood, sending oxygen all over the body.